All right. Good afternoon, everybody. Let's start the way we always start. That no matter what we face, even a worldwide health pandemic, that we are strong, we are resilient, and we know that we can get through this together. So say it with me. We will get through this. We will get through this together. One last time. We will get through this. We will get through this together. We have a lot to cover today in a shorter period of time. What we're going to do today is first give the COVID update. Second, I'm going to go back over some of the comments we made yesterday because all of the nuances don't always make Twitter. And third, Michael Brown is going to give an update on the McAtee investigation. Given I think that there'll be very different questions, we will stop to do a period of questions right before that update, and then we'll have a separate round of questions primarily for Secretary Brown after the last part of today's update. So first, on COVID, we continue in Kentucky to reopen our economy. While we have seen numbers generally rise some, what we see is a positivity rate that still suggests that we can do this and we can do it safely. We are seeing whether it is retail, restaurants, hair salons, and others, and people having the ability to reopen and working very hard to do it safely. All around the Commonwealth, I have seen people going the extra mile, taking these precautions very seriously and with good reason. We have seen where people do not, whether it's in Kentucky or across the country. This virus is still aggressive and it's still spreading. So it's very important that we make sure we follow those healthy at work guidelines so we can do this and we can do it right. Remember, our two goals here is to be able to successfully reopen our economy without having to pause it again. If we are able to do that, I believe that we will come out of this with one of the stronger state economies. And second, to do everything we can to get our kids back in school this fall. So just a couple of specific announcements for all of our industries that right now have a capacity limitation, like retail at 33%, restaurants and others. At the month date to where they've been operating for a month under that 33%, we are going to increase that capacity to 50%. That means that we have gotten the practices in. They are becoming a part of what we are doing, and that will be the next phase we will be able to move towards. Now, we'll have those dates for you here in the future, but they are a month from the original date. The second is that pursuant to a very serious proposal, with one change, we have approved the state fair proposal. It'll look very different this year. The main thing is we are ensuring that we are keeping especially the agricultural competitions and so many of the things that make the fair so great. Again, this is all subject to us continuing to have a handle on this virus and to doing things right, but to everybody who worked to help put together that proposal, we appreciate it. One thing that the State Fair will not be able to do is to use that portion of the Expo Center that has the field hospital in it. We are seeing surges in other states. We need to make sure that we have this in case it's needed. In fact, in Arizona, they're worried about bed capacity right now. This is fully set up. It's ready to be reopened when needed. We are nowhere close to needing it yet. But if we took it down and later needed it, that's something that none of us want to have to live with. All right, today's numbers, again, show the virus is still out there. They are above yesterday's number, but below what we've seen a couple days before that. So today we're reporting 245 new cases of COVID-19. 91 of them are in Jefferson County. Again, we're seeing a significant percentage of our cases ranging from really 20 to 60 on any given day, all coming from Jefferson County. So there's 91 new cases there. There's 29 new cases in Warren County, which continues to have significant positives, 18 in Fayette, which are seeing their rates go up. When you are healthy at work, we're going to see rates go up at least some. They've also had testing there like Louisville has had at one of the highest levels in the state. Shelby County, 14. Allen County, 11. Madison County, 10. Woodford, 7. Boone, 5. Christian and Logan, 4. And then 3 in Bourbon, Bullitt, Franklin, Gallatin, Lincoln, and Rowan. 2 in Adair, Edmondson, Hardin, Pike, Russell, Simpson, and 1 in Barron, Bell, Boyd, Butler, Callaway, Carroll, Clark, Fulton, Garrett, Graves, Jessamine, Kenton, Marion, McCracken, Morgan, Muhlenberg, Owen, Powell, Taylor, Trigg, and Whitley. Again, this should remind us that this virus is everywhere in Kentucky, and we need to continue to use the good practices that we know help us to manage this virus. We need to continue to get tested. Now, I was tested again yesterday. The result was negative. That's why I'm standing here today with everybody. But we got to continue to do that. We got to continue to keep our tests up. That gives us data that we need as we move forward. We also have to make sure that as our contact tracing capacity grows, that every Kentuckian answer the call and be willing to work with those contact tracers. If we can do that, if we can continue testing at a high capacity and people are willing to work with the contact tracers, it means if there is a significant spike that we can approach it surgically, that we can ensure whether it's the area of the state or the potential industry, that we can approach it in a fashion where we don't have to pause anything else. But the only way that we are able to do that and continue it successfully is continue to test, continue our contact tracing, and follow those good habits, continue to social distance. Those 245 cases are out of a total number of tests of 287,597. Now, it's only about 2,000 more than yesterday, but we did one of our audits again, which meant some tests were removed that we had conducted, and then we had an additional, about 7,000 yesterday. Current number hospitalized ever, this isn't current, 2,386. Currently, 525. Now, that's a number now that we're watching more than ever. That's a number that helps determine our healthcare capacity. That's going to be one of the key numbers moving forward. The ICU, ever in the ICU, 966, currently 75. This number has hovered fairly low, and what that means is if people get very, very sick from this virus, there is room for them. When that number rises, and if it rises significantly, again, that will tell us that we have a problem. And my favorite number, the number recovered, 3,365. Now today we are reporting 5 new deaths to COVID-19. 2 of those are in our long-term care facilities. We continue to lose Kentuckians of all ages. And it continues to be a time when our compassion is needed. Even with everything else going on in the world, let's make sure that we have enough compassion, and we should all have limitless, or at least try, for these families that have lost someone due to this virus. Those lost today include a 95-year-old man from Warren County, a 53-year-old woman from McCracken County, a 58-year-old man from Shelby County, an 82-year-old man from Barron County, and a 69-year-old woman from Jefferson County. So let's continue to light our homes, our businesses, our universities, our facilities up green. Let's continue to ring those bells at 10 a.m. We cannot have COVID fatigue. We have to push on and do everything we can to defeat this virus. When we look at the age and racial breakdown, of total cases, 83.58% non-Hispanic, 16.42% Hispanic. On race, this is just of cases, 73% white, 15.28% Black or African American, 5.14% Asian, 5.93% multiracial. On deaths, on ethnicity, 96.5% non-Hispanic, 3.5% Hispanic. And again, the statistic that lays bare inequality that we've seen in healthcare for decades, if not centuries, on death by race, 79.52% white, 16.74% black or African American. It continues to hold at twice the percentage that black or African American Kentuckians make up of our population. 1.76% Asian, 1.98% multiracial. When we look at our long-term care facility numbers, we continue to track these. We've got 10 new positive cases of our residents. Given the amount that we're testing, that's a pretty good number for today. 26 staff. And we've seen this in facilities that you go in, you test all the staff, you have more asymptomatic positives than you'd expect. And then 15 deaths that we've previously reported, and a couple of them today, but when we learn that they are in long-term care facilities. And so when you look at our current number of Kentuckians lost, 477. That's 475 lab confirmed, 2 probables that we're waiting on, out of a total number of cases of 11,708. You look at these numbers, and it shows you that they can truly be deadly to our population in our long-term care facilities. And we need to continue to realize that while visitation rules and others can be really hard, this is a population we have to do everything we can to protect. All right, I want to briefly comment on some commitments we made yesterday at a time when our next generations are demanding a better world, and that we address injustices that have permeated and continue to permeate our society. We made 3 commitments yesterday, and I'll go in the reverse order that we talked about them. The Lieutenant Governor made her commitment to address bias in our education system and to work on programs to ensure we have more black teachers in our classrooms. The evidence there shows that that improves outcomes. We ought to be doing it because it's the right thing, and we ought to be doing it because it helps our kids. Second piece, law enforcement training. I want to make sure I clarify that our law enforcement training at DOCJT, where we provide training to law enforcement around the Commonwealth, does not include Louisville Metro, does not include KSP, and does not include Lexington Police. So when we talked about the only cultural awareness training, being that for dispatchers, that applies outside of those 3 areas. My understanding is that LMPD, KSP, and Lexington Police have more of that training, though I received word that they're committed to more of that training as we move forward. But I think it's important to be accurate on that, and that everybody deserves to make sure that we have the right facts. And the last piece was my commitment on health care. I want to make sure, because this is hard in an 8 or a 9 word tweet, to talk about the what and the why here. I believe that health care is a basic human right. And when I campaigned, and it's hard to believe that that campaign just ended about 7-8 months ago, I made a pledge that we would work to sign up every single Kentuckian for some form of health care coverage. Private insurance, Medicaid, Medicare, depending on what people qualify for. We started on that in office by rescinding a Medicaid waiver that would have kicked 90,000 people off of their coverage. And then we pushed in our state budget for funds to cover all uninsured children, basically to reach out for them because they all qualify for something. The legislature didn't include that in the budget. But where we are now is seeing that COVID has shown us where our priorities have to be in terms of where we start providing this type of coverage. When we have in the middle of a pandemic that's going to continue until there is a vaccine, a portion of our population that is dying at twice the rate they make up, which isn't the case for any other part of our population, then don't you believe that we have an obligation to go out and ensure especially that community right away is able to sign up for a form of coverage? You know, we have somewhere between 18 to 20,000 Black Kentuckians that don't have any form of coverage. Our goal, and it's a short-term goal, is to make sure that we reach out to every single one of those individuals and get them signed up for some form of coverage. Many will qualify for Medicaid or expanded Medicaid. There's also the private market and other means. What I have as the tools at our disposal on the ground, I want to make sure that everybody can see a doctor, can be healthy, and especially if they have complications from COVID, can get the help that they need. That doesn't mean that we're going to stop there. Eventually, we want to get to make sure that everybody who doesn't have coverage has coverage. Again, using one of the forms that's out there. But we have an obligation right here and right now to do what we can for a group that has been subjected to racial inequality in healthcare. Dr. King even talked about it. And we're still addressing it right here. And at the same time, it's being preyed upon by this COVID virus. So that's our commitment. It doesn't exclude anybody else. We want to sign them up too, but my commitment is that we're going to sign up every single individual in that community for some form of health care, and I'm already getting calls from partners out there that want to help. We went about this type of process, not as targeted, but this type of process when Connect was launched in the expansion of Medicaid, and there are methods out there that absolutely work. Our commitment in this initial step is to make sure that we use anchor partners in that community to help us do the work. And that could be everything from Simmons to the Urban League to so many of our faith leaders that can identify individuals in their churches or in their communities that we can help. So with that, I'm going to open it up for about 7 minutes of questions so that we can then get into the McAtee investigation, where Michael Brown, who is monitoring that, will provide an update and answer questions. So, Joe?
State Representative Jason Dean has filed a lawsuit alleging that having only one polling place in Orange County is a form of voter suppression, especially for Black voters. Do you have a reaction to that?
I want to read the lawsuit that's been filed. I was told we were listed, though we don't have a role in determining that number. I want to make sure that everybody has an opportunity to vote and to vote safely during this virus. I certainly want everybody, can you put up the signups to go online and request an absentee ballot? This could be the easiest way to vote that we have ever had in our lifetimes. And this is the safest way, especially if you fall into a category where you are most at risk for COVID. Please go online and everybody vote. Everybody vote, and you got to request your absentee ballot by June 15th. That's coming up. That's also my son's birthday. But make sure you request that ballot by that period. And we'll look at and evaluate the lawsuit. I want to make sure that we don't make voting harder, but we also make it safe in the middle of COVID. Chris?
Why were you tested yesterday again for COVID-19? Some of us have seen this picture going on social media of you with your mask pulled down, talking to someone at a rally who appears not to be wearing a mask. Was it because of your exposure potentially? Or are you getting tested regularly?
I'm getting tested regularly. That is the fourth test that I have received, all of which have been negative. I've made it, I've tried to avoid crowds. I've tried to model certain behavior, but when 1,500, primarily young people, marched on this Capitol demanding a better world, that required more than just an exception. Now, this is a moment in history where I wanted to make sure that they knew that I was with them.
In regards to some statements that the World Health Organization made recently, I know that they said yesterday that spreading the coronavirus from asymptomatic people is rare, and I think that clarifies some of that. But I wanted to get your take on that statement, and maybe Dr. Stack's take on that statement in regards to what it means for Kentucky moving forward, if that happens to be true.
Thank you, and thank you, Governor. The question has to do with the statement that came out from the World Health Organization yesterday about asymptomatic transmission of COVID-19. And in that area, I would say that I respect greatly the World Health Organization, the CDC, and all the other public health experts who are out there trying to help us navigate these uncertain waters. I think that was a premature statement. I think the WHO has walked back that statement. The evidence and the jury is still out, and I say that because that is the current state of understanding. Some modeling has shown up to 40 or 40+% transmission from asymptomatic people. We just don't know yet for sure, but we know there is a large number of asymptomatic COVID-19 infected individuals who are out in the communities, and that they are at risk for spreading the disease. So I would not take one data point, one news story, and allow that to be expanded to mislead folks that this is not a dangerous disease that does not spread from person to person, because the evidence suggests that it does.
Catherine?
Healthcare plan, you talked about how money would be needed to make this happen. Where would that money come from and how much?
Well, we're still, again, we made the pledge and the commitment because now is the time. We're formulating the plans, but it's a mixture of dollars that are already available within our cabinets because we have a Medicaid budget that provides for those opportunities. There's chances working with our MCOs, and there's also the opportunity with the CARES Act because right now anyone not signed up for coverage, anyone, is someone we need to get signed up for coverage. And that type of outreach, whether it is encouraging people to be tested or to work with contact tracers or to get signed up, is a use of that money that we should be using. And when we're seeing a part of our population die at twice the rate of anybody else, then we need to make sure that CARES Act funding is flowing to folks that are most at risk. Lawrence.
You mentioned the state fair would look different. How different would it look, and why would you approve that plan that will bring, regardless of the regulations, bring people together?
Well, the state fair will look very different. Most of it will be occurring outside, though there are some inside. There are significantly less vendors, and the overall activities are less. Any concerts are going to look different and be outside, and put together a really comprehensive plan that as long as we are still in control of the virus and where we are, is something that we believe that we can do at this time. That proposal is an open record. You want to request it, we'll get it to you. Joe?
With 245 new cases today, that's twice what we saw yesterday. The rolling 7-day average is 209, I believe now, which is still higher than it was last month, I guess. So is there any disconnect between that rate continuing to go up and increasing capacity to 50%?
Well, our concern would be if the number of cases continues to escalate and escalates especially with the multiplier. When we had to take the steps we took at being healthy at home, we were seeing it double every week. Right now, if it can stay within a range, especially around the positivity rate, which has been within a percent, even in our weeks when cases are low versus now, then we believe that we still can handle the reopening and do it safely. Now, we got to keep having people tested. We got to continue to build on our contact tracing. But we're going to continue to watch all the numbers and then address it, preferably surgically, specifically in areas we're seeing it, and not have to have overall pauses. Chris.
With the push to get people signed up for healthcare that you announced yesterday and you talked about today, I have a question about the overall picture of the deaths and the people who've been impacted. Have you done any studies of the economic status of those people who've been at the highest risk of dying as well, to see if poor people, regardless of their race, are at a higher risk of falling victim to COVID-19?
Yeah, the question is, have we done studies on whether socioeconomic factors, poverty, is also contributing to death? We don't have any long-term, well, there can't be a long-term study. We don't have initial studies back on that piece. What we can say definitively, if you put up long-term care, is that right now the major factors on how lethal this virus is your age. And then it is certainly the next factor that we see is race. And for those that have to be in a facility because of poor health, it adds on. Now, there's certainly connections between poverty and overall health, and rates of diabetes and of lung disease and of heart disease and of lung disease. And there's certainly going to be a correlation there. What we also see is larger impact based on how densely populated an area is. Now, we've lost a lot of people in other places, but all of those are things that we see right now in this disease. I'm certain that there will be a poverty link along with a number of others. I mean, if especially those that are in poverty, if you haven't been covered by health insurance. And remember, we only expanded Medicaid a decade or so again, then you haven't been seeing a doctor long. You haven't been necessarily getting into the preventative health that you need. Joe.
Message from a woman in northern Kentucky that had some issues getting tests. She said she's running difficulties actually trying to get a reservation for that sort of thing. Do you have any concerns with the availability of testing in counties like Boone, Kenton, or Campbell, or how do you go about addressing that?
So that the question is, an individual in northern Kentucky had trouble getting a reservation for a test. We can provide you with 3 or 4 different places within the area that you should be able to get one. One is St. Elizabeth's. The other is any of the first care centers that are out there doing it, and we can work with her to even get a test sent to a facility. Right now, we are not seeing obstacles. Sometimes there are payments involved. We're working to make sure that that's not the challenge. But no, we're not seeing, that's the first complaint I've heard of difficulty getting a test. We still have large numbers of people getting tested, over 40,000 each of the last 4 weeks. My bigger concern is testing fatigue. Now, it's not comfortable, though the newer tests are less uncomfortable, but it's really important to keep us safe. Catherine.
Required to remove the Jefferson Davis statue, and have you taken any further steps?
We're working on further steps right now. I believe we'll have an update on that either tomorrow or Thursday on actions being taken. I'm committed to removing the Jefferson Davis statue. It's time. It's way, way past time. Lawrence.
Questions from people who are mentioning contact tracing. They're concerned about potential fraud, people posing as contact tracers and calling their phones, getting information from them. Are there measures to protect against that? And what about, there's also a question about this is violating HIPAA at all?
Certainly on the HIPAA side, they've worked through those issues, and our contact tracers that are in all of our health departments are used to doing that and dealing with those issues. I don't see a concern there because the way identification works, they don't call and tell you the name of the individual that you've been in contact with. On the cybersecurity side, we'll get Mark Carter to give an update on that. There are always con artists trying to prey on us at times when people are relying on accurate information. So I'll get our measures on that. All right, we'll now turn it over to Michael Brown, who's going to give us an update on the David McAtee shooting. I promised when we started this that we would have an independent investigation and that we would provide the truth, and that as evidence came out, we would provide it. Well, today, Michael's going to provide some more evidence. It is not all of the evidence, but we're going to prove today that we were committed to getting that truth out, good, bad, or ugly. That's our commitment, and I'm going to turn it over to Michael Brown.
Thank you, Governor. Well, it's well known now that on the night of May 31st into the early morning hours of June 1st, the Kentucky National Guard was operating in support of Louisville Metro Police Department and at the request of Louisville Metro. That night, they accompanied Louisville Police Department to the vicinity of 26th and Broadway. where at approximately 12:16 a.m. there was a report of that group of law enforcement taking fire and subsequently returning that fire. Now, there's been video footage that had been obtained by search warrant that has been released. There's been a compilation done by the New York Times showing some of these events, and I'm not going to walk through all of those this evening. Anyone can watch them when they can. But on that topic, the Kentucky State Police is working with the FBI. The state police is going to do a frame-by-frame review, and I understand there are 29 frames per second of these videos, which means that for a 2-minute period of video, it's going to be over 3,000 frames that need to be reviewed. The FBI is also working with all the video that has been obtained to create one that shows the incident from various angles. I can't give you an exact time frame tonight of when those videos will be available, but when they are, I will let you know. Now, previously I reported that David McAtee appeared to have succumbed to a single gunshot wound to the chest. That still remains our conclusion. And tonight I'm providing some further details on our findings. First, we have been able to conclusively identify the type of weapon that fired the fatal shot. Second, we have identified that the 9mm pistol seen in the videos with Mr. McAtee and found at the scene had fired at least 2 shots that evening. And you can see that in that one frame, I'm not going to play the video, but you can see the weapon on his hip, and you can also see someone pointing at the weapon on the ground. And later on, I'll show you some more pictures of that weapon exactly as it remained after the shooting incident was over. Lastly, I'm going to show you that, or report to you that David McAtee, we had examined him for gunshot residue, and in fact, we did find gunshot residue on his person from that evening, and I'll get into that detail. All right, let's turn now to the forensic evidence that determined the fatal shot, or at least the projectile. Yeah, well, play that video, that's good. All right, this is a video from across the street at Dino's, and it's very short. You'll see some officers, moving around. And then in a moment, you'll see officers react. And in the top of the picture, you can see 2 uniformed National Guardsmen moving behind what I'll show you later is a blue Chevrolet, along with a LMPD officer. Go back one. The video, I'll show you if I can on the screen, and obviously the laser will pick up there. But under that blue awning is the doorway where David McAtee was standing. You've seen that in the other videos. The blue Chevrolet is the one I just referred to that the 2 guardsmen and the LMPD officer retreated towards after they heard and witnessed shots being fired. The little green cones that you see all around there indicate shell casings that were recovered by police investigators as they lay at the scene the next day after the shooting. This was critical for us to determine the number of rounds that were fired and which weapon had fired rounds from a given location. This is, in its very, very technical terms, an M855 caliber 5.56 military-grade ammunition. It's a bullet. It's very distinguishable by its bright green tip. In fact, it's referred to as green tip ammunition. This was the ammunition that our military carries overseas, and in fact that the National Guard was carrying that night. I had mentioned before that early on that we had recovered, I said, 3 fragments from Mr. McAtee. It turned out that and that was a preliminary autopsy, actually there were 4 that were recovered. I don't want to leave this up too long, but if you notice that on this particular fragment, you can see this bright green paint. our crime lab actually went and analyzed the paint you see there against the paint that was in the magazines from all of the other from the National Guard weapons at the scene. It is consistent, and in fact, the material that this bullet was made out of is consistent with those rounds. So in weight and size and color and alloy, it matched up to the type of round that I showed you at the very beginning. This is a further detailed analysis of one of those fragments. As you can see, the fragment was severely damaged. It was bent, twisted, once it was recovered from Mr. McAtee. What it means is that our crime lab was not able to match up these particular fragments with a particular rifle. They could only match it up that it was that particular caliber and type of ammunition. But we know that that night, those rounds were only fired by one agency, and that was the Kentucky National Guard, responding to the fire that they had received. Therefore, it's our conclusion that Mr. McAtee's fatal wound came from one of the M4A1 carbines carried by the National Guard. But we cannot identify which carbine, and we cannot identify which guardsman fired those shots. It also absolutely excludes Louisville Metro Police because the weapons they fired, and I should note this, there was one that was a Glock 19, and there was another that was a 9mm Glock 19 and also a .40 caliber Glock 22 that were reported to have been fired. We recovered those shell casings, but clearly and conclusively, the wound was caused by a National Guard round. Next, we turn to the other weapon in question. This is a shot of that awning is the same blue awning that you saw in an earlier picture, and the doorway is under that awning. When the crime scene was processed the next day, you can see some markings on the ground. Those green cones refer to evidence, and in this case, number 34 is going to refer to a shell casing from a 9mm pistol, which was found directly outside the door. There was also another shell casing, which would be identified as item 28. Well, okay, we'll get to that one. This is a photograph inside the door. If you remember the still I showed you a little while ago, it was of the person pointing to the weapon on the ground, and you had seen the Mr. McAtee with his hand on a pistol. And actually, when we examine that pistol, it is unusual. It's called a Jimenez Arms 9mm pistol, and the ammunition it was loaded with was called Tool Ammo 9mm Luger. So there is the pistol as it was, after it was dropped, after the shooting that night, and that's where it remained. And I think we got another close-up of it. You can see it has a very stocky grip and a sort of square shape to it. And viewed from the rear, it is significant and different from, for instance, the Glocks that the police carry. Do we have another one of the shell casings? Okay. Yeah. You have a close-up? All right. There you see right to the side of that 34, if you can see it, it's a little stovepipe metallic object. That is a shell casing. That shell casing is for a 9mm Luger, and our crime lab has determined that that shell casing and another shell casing found right outside the door had been fired from the weapon that you saw lying on the floor, which we have confidence is the weapon that David McAtee had in his possession the night of the shooting. Finally, the last piece of forensic information that I can report on is that Mr. McAtee was tested for gunshot residue, and those reports came back positive. Those reports can indicate that, and I want to be clear, that one of the particles found indicated that he had, it was consistent with a firearm discharge. 5 other particles were consistent with him either handling or being around a weapon that had been discharged. And sometimes those other particles can come from, and they can remain on the outside of a gun if you just touch the gun. So I can't absolutely say that those particles came from a particular shot, but clearly Mr. McAtee had gunshot residue on his person after these tests. So it's clear. The fatal shot came from the National Guard, described the weapon. We have no doubt about that. Mr. McAtee's weapon was tested, and the shot casings that we found outside the door came from that weapon, and he had gunshot residue on his person. That, right now, other things have been going on. There have been over 100 interviews, and I do not have summaries, or neither have I reviewed the interviews. We are still attempting to go through a lot of radio traffic, and the FBI, KSP is also going through even body cameras of people who are not necessarily in view of the shooting, but might be able to pick up more sound so things can be synced up. There's a lot more to do, but this is very conclusive of a critical part of our investigation. It's information we wanted to get to the public as soon as we could absolutely confirm it. Thank you. Questions?
Do you believe that there were other LMPD officers who had their body cams on and activated at the time of the shooting who were not involved in the shooting?
Well, they were all, I'm talking about ones who were at the scene who did not fire their weapons. And we believe that at some point in time, some of them either had their body cameras on or activated their body cameras. The issue becomes, once those shots were fired, as you can see, many people had turned in a different direction or were going for cover, which means that a lot of the body camera footage was going to be blocked. We expected that, but the FBI, in their attempt to create an overall view, is going to, and they have the technology. I was told that they're bringing people from Quantico to try to sync up all the sound and all the video to get us a clearer picture, if you will, of what happened. Lawrence?
Based on the shell casings from Mr. McAtee's gun, can you tell where he was firing or at whom he was firing, what direction?
I don't know that I can positively, he was clearly firing in the direction outside the door. He wasn't firing inside the building, he was firing outside the building. The first round that you see, the shell casing that fell to that floor mat that you see and got captured there, is directly in front. It would be consistent with the weapon being out, or at least partially out of the doorway. The other one was found a few feet away. Now, we don't know whether it landed there right then. It could have been kicked, it could have bounced. I don't know with this particular weapon how the ejection actually works to show where it goes, but they were in that vicinity and right in front of them.
The two guardsmen next to the blue car, are you positive those are the two guardsmen who fired their weapons that night?
When I say positive, we know that that night there were only 2 guardsmen who fired their weapons, and both of them appear to, if in this and other videos, everyone reacts to the first shot. Then we know that there's at least approximately an 8-second delay, which is reaction time when you see officers, and including those guardsmen, retreat to cover. That's what they did, and then after the next shots came out, we believe that they returned fire, because if you looked at the image I showed you by that blue Chevrolet, that's where those shell casings were accumulated from the Guard rifles. We found no other shell casings from Guard weapons in any other vicinity, not close to there. So we believe absolutely that those were the 2 who fired, but again, we don't have the capability of determining, because of the damage to the fragments, which rifle it came from.
Can you determine who fired first in this whole situation? Was it Mr. McAtee, was it the guardsman, was it LMPD?
Say again now.
Do you know who fired first? Was it Mr. McAtee, was it LMPD, was it the guardsman?
I believe it was Mr. McAtee, because clearly in the other videos you see, and you look at it from the sound of the report, and you can't overlook the reaction of the people in the video itself. They are responding to shots coming from a given direction. They were all retreating. I believe Mr. McAtee fired the first shot, paused, and came back up, as you've seen in another video, and fired again. Yes, sir.
All of this that happened, I
You're gonna have to hold your head up, because, see, I gave my ears to my Uncle Sam, so I can't hear you.
I understand, but in regards to Chris's question, it appeared that they were firing pepper bullets first into the house, were they not?
Okay, the National Guard does not carry any pepper balls or any type weapons. The only weapons just a minute, the only weapons the National Guard had that evening were the M4 carbines. There appears to be a Louisville Metro police officer who was firing it's like an air gun, and fired some pepper balls. That weapon, that device, does not make nearly the type of what we would call report. You might call it a bang, like a pistol or a rifle shot. They're not even close to being comparable. That's why as we analyze the videos and you analyze the reports of these weapons, and you respond and you hear them talk about shots fired and that's picked up, those gunshots, even by a civilian video on a cell phone, it's very, very distinctive that there was gunshot first, pause, more gunshots, return gunshots.
Do we know if LMPD fired the pepper balls in the direction of the building before McAtee fired his gun?
I don't know really about the actions of the LMPD other than what I've actually seen in some of the videos that you've seen.
You were experienced in the courtroom as anybody in Kentucky. You've served in the Attorney General's office. We've all seen you in action. You're laying out this case for us, and the question remains, if you were going to prosecute, could you see yourself at this point prosecuting any of the law enforcement or National Guardsmen who were involved in the shooting that night?
If you're asking me based on the information I have at this time, it appears to me that they were returning fire, which is part of their, the engagement and what any law enforcement officer would do with that case. I can't tell you what Mr. McAtee he was firing in their direction, and he did it at least twice, and they returned that fire.
Rounds were fired. How many rounds were fired by the National Guard, and how many were fired by LMPD?
Right. We believe that the National Guard fired 9, possibly 10 rounds. I reported the other day that it was a total of 18. It might actually be 19. I'm trying to account for one more shell casing. We believe that the Louisville Metro Police fired 9 rounds, 1 from a .40 caliber and 8 from a 9mm.
The guards, the troopers involved in the shooting right now?
Their status is, my understanding is they are being, they are going to be interviewed, I believe, very shortly. And other than that, their status is just that there is an internal investigation, if you call it, based on a serious incident by the National Guard itself. And I understand they were removed from active duty at the moment, but again, right now, our Guard is not activated either.
Yeah, are you going to release the identity of the 2 guardsmen that fired shots that night?
Say again now?
Are you going to identify the name of the guardsmen?
Go on.
I believe that the Guard itself is going to put out a statement on it. Neither Secretary Brown or myself know the identity of the Guardsmen. That's been with their JAG, which is their military lawyer. And I believe they're going to put out a statement on that here soon. So what we pledged is to provide evidence as we received it. Secretary Brown has laid that out using some of his experience. There is still significant evidence remaining to be gathered, and there are still going to be questions as we continue, and there may be some questions that we can never answer. My goal is to be truthful and to provide you everything that we have in context as it comes in. The fact that there is an individual who is no longer with us is tragic, and our goal is to make sure that each and every fact get out there and that people can see them. I hope that people see that our providing the evidence today showing it was around from the National Guard, something that we have put out for the world and Kentuckians to see and to know. is proof of our commitment to making sure everybody has all the facts and that we continue this investigation at a significant pace and speed. I believe everybody deserves the truth. Thank you all very much.